This morning on Today's Woman, estrogen and menopause. A new study reports the hormone does little to improve a postmenopausal woman's quality of life. So what is a woman to do? Dr. Mache Seibel is a professor of obstetrics and gynecology at the University of Massachusetts. 40-year-old MARION BODNER is starting menopause and is struggling over the decision to use hormone therapy. And 54-year-old Karen GIBLIN, right? Yes. GIBLIN, not GIBLIN, has been on estrogen since 1991, and she started her own website, Red Hot Mamas. Wow. Good morning to all of you.
Good morning, Katie.
All right, this is so confusing, and as you know, women don't know what to do. So first of all, in layman's terms, or laywoman's terms, Dr. Seibel, can you interpret the study and basically tell us what it showed?
Well, this is a study that was part of the Women's Health Initiative, and what it looked at is a group of women who started treatment in this study at the age of 60. And they were then either given estrogen only or they were given a placebo for a window of time, and then various parameters were looked at, like sleep or overall feelings of quality of life and so forth. And it tried to make sense out of that, giving only estrogen to these groups.
And the reason it was done on women who had a hysterectomy is if you haven't, it's important to take progesterone along with the estrogen to decrease one's risk of uterine cancer.
Right. If you have a,
I can't talk today, sorry.
If a woman has her uterus, she has to have both estrogen and progesterone in order to protect the uterine lining. But without the uterus, a hysterectomy, then the woman is able to just take estrogen only.
So what happened to these women? Did they sleep better? Did their moods improve? Did their quality of life seem better? I guess not, right?
Well, actually, sleep improved slightly in this group, even though they didn't play that up. Sleep was one of the parameters, or the one parameter that actually overall did get a little bit better. But when they asked women the single question, sort of, is your life better now than it was so many years ago, the answer didn't statistically differ between the two groups.
Interesting. Why do menopausal women have trouble sleeping, by the way, or wake up frequently during the night?
Well, there's multiple reasons. One of them has to do with the effect of estrogen on the brain and its effect on deep sleep, and actually affects brainwave activity. And so estrogen does have a real medical benefit in terms of sleep. But also, it's because in the absence of estrogen, women are going to have more hot flashes, and they're going to be woken up in the middle of the night, and that's disruptive.
Isn't it great being a girl?
Oh, it is.
Yeah, but I know, Karen, you're 54, as I mentioned.
Yes.
You've been on estrogen since 1991, right?
I was one that had the total hysterectomy at age 40, so my symptoms were very, very severe because I was premenopausal prior to my surgery, and I felt that they were very debilitating, my symptoms. I was having the devilish duo, the hot flashes, the night sweats, waking up drenched, not being able to sleep. I was very involved in local politics in my town, Ridgefield, Connecticut, and I was very fortunate because other women knew me in my constituency. They started calling me, asking me questions about natural menopause, surgical menopause, and I knew that I wasn't getting enough information, nor they were, from that traditional office visit with their doctor, the 7 to 15 minutes. And that was the thrust of my developing the Red Hot Mamas education program all over the country. But being in the throes of menopause, having surgical menopause in 1991, not having an array of products that were available during that time, you know, it was very confusing for me, Katie.
And what about the study, the recent study that made everybody say, wait a second, estrogen may not be so good at preventing heart attacks in postmenopausal women, and the increased risk of breast cancer, albeit slight? A lot of medical professionals feel that study was flawed and misinterpreted. What's your take on that?
Well, it did create a baby boom dilemma, because what happens is women are having the symptoms, the night sweats, the hot flashes, difficulty with sleeping, vaginal dryness. They're having these problems, and they want to be treated if they can, and estrogen is one alternative. The take on that in specific terms is, I think that estrogen is still a good medication, but it has to be individualized. What is the woman's risk? What is her fear factor? If a woman has blood clots, if a woman has a heart attack, if a woman has a history of breast cancer or has breast cancer herself, if she has terrible migraines, that woman is not a good candidate for estrogen.
So obviously your gynecologist needs to go over all these factors, and can't they tailor make these estrogen supplements specifically for your needs? In other words, they do that FHS test, is that what it's called?
FSH.
Well, that was close. Okay,
Yes, it is.
FSH close test to determine if where you are in terms of menopause, and then they can make something that's
That's a
sort of-
very crude indicator. In other words, what the FSH test does is give you a window of time where you're in transition towards menopause. It's not a point in time that says, you're in menopause. It just says you're heading in that direction.
And meanwhile, Marion, I know you're in the early stages. You're starting to have night sweats and hot flashes, and you're not having one right now.
It's always hot in here, you know, it's always hot.
Yeah, I always say to people, "Is it hot in here?"
I do the same thing.
Anyway, so what are you doing?
Well, I'll tell you, when my mom was pregnant with me, she had breast cancer during the pregnancy. So she had to have a mastectomy right after she gave birth, and she had another breast cancer at the age of 75. So,
So you're in a
I
bit
don't
of a
know.
conundrum.
And I'm taking all the creams, the phytoestrogen creams and the progesterone creams, and I'm taking vitamin B12 shots.
Are they helping? You're doing the shots?
Nothing is helping.
Wow. So
Nothing.
Dr. Seibel, what do you do?
Well, you have to individualize. I mean, this is a very challenging problem for you because you have a personal fear. I mean, you're afraid. And
But
when you
with reason, right?
yes, with reason, but it's a relative reason, not an absolute reason.
Should she do a genetic test for the BRCA?
BRCA, yes. Well, that is one thing that's going to let her know if she has a specific risk. But remember, most women that get breast cancer don't have BRCA
Right.
gene. About 90% of them don't have it. So what has to happen is you have to explain what the expectations are and give her the options for treatment along the way.
Well, I'd love to have you all come back because I think women are so confused.
They
and they
are.
really do want help.
It
and
takes
they
me an
need-
hour to explain to women what they need to do for them as a person, and it can't be done it's very hard to do in a few
Well,
moments.
come back and we'll give you 4 minutes.
We can do it.
Anyway, thank you all so much for talking with us this morning. I do
Pleasure.
hope you'll come back because I think women don't know what to do.
They don't.
And we'll be back with more today right
Thanks
after
for having
this.
us.
Thanks.
Thank you.